Welcome back. Should anti-vaxxers be denied access to some things? Well, the Health MEC in Limpopo, Phophi Ramathuba, is set to engage with liquor traders about refusing to sell alcohol to those that are not vaccinated. This is part of a campaign to ramp up vaccination in that province. Let's speak to the MEC now. MEC, thank you so much for making time. Welcome. Have you already started engaging with the liquor outlet owners about this campaign?
Afternoon to all your viewers, and thank you for inviting us. Yes, as the Department of Health in Limpopo, we've already started to engage them. But I must caution people to appreciate the fact that there is no law that forces anyone to vaccinate. Vaccination is not compulsory in our country, and that includes Limpopo. However, as a department, we can't just fold our arms and keep on complaining about vaccine hesitance when we know that we can engage the liquor industry, because looking at one sector that is hard hit every time you have a wave, it is the liquor industry. And we, as the Department of Health, are the first to make a call that can the president regulate and ban alcohol, because we get the impact of alcohol trauma cases vis-a-vis what we need to deal with in COVID-19 cases. Now we're saying here is an opportunity for us to avert the fourth wave. And this opportunity can be through vaccination. We've seen that the mask, the social distance, they do help. But however, we have lost more than 78,000 South Africans. I was reading a headline of saying 95,000 children are going to remain orphans in this country because of COVID-19. Now, these are the issues that have pushed us to say, let's talk to the alcohol industry to say, please talk to your customer, look into your situation wherever you are, to say, if you are not vaccinated, we will not sell you alcohol, because we want all our customers to be vaccinated. Yeah. Because if customers are not vaccinated, we're going to get into the fourth wave. When we get into the fifth wave, the first thing that we are going to ask the president to do is to ban alcohol. It's up to the industry to decide whether they accept our proposals or not.
Yeah. Have you looked at the legal implications for this, MEC? In other words, is that in line with the law? Can outlets actually refuse to offer a vaccine, well, to offer a service, I should say, to a person on the basis that they have exercised their constitutional right not to take the vaccine?
I think in our discussions with the industry, these are some of the suggestions that we have looked into for them to also look at implications of that. But what we are saying, we will give a public health advice to say we are dealing with the pandemic. That is a notifiable disease that has caused serious global crisis in terms of the economy. Remember, when the economy collapses and people lose jobs, the community tend to forget that the hardest hit sector is the health sector. Let me give you a simple example in my province, where 91% of the population is dependent on the public health. Less than 9% has got medical insurance. Now, when you lose jobs, that less than 9% tend to lose even medical insurance. Not that, they tend to develop stress. The stress leads into depression with medical conditions like diabetes, hypertensive, which were not there. We have seen those conditions in the past 18 months as a result of COVID-19 pandemic. And that still, again, put much more pressure on the very same healthcare, especially the public healthcare that is currently struggling with the resource. So for us as a Department of Health, it is our interest to get the country going back to normal. So if it means we need to talk to any industry, I mean, we're going to talk, for instance, to those who organize soccer games. If they do buy the idea to say, we can open stadiums today, and then for you to access the stadium, you must be vaccinated. We will propose all that. We're not saying it's law, it's our wish. And we're saying maybe if we are to do these things this way, we can get all Limpopo people vaccinated and get into the herd immunity that we want, and the country go back to normal. Just this morning, I was vaccinating our queen in the artist industry, Makadzi. You know, the painful stories that our artists are going through because the entertainment industry has been hard hit by this pandemic. She was calling upon people to say, come and my followers get vaccinated because I want to go back to the stadium and perform and entertain you. So we are working together in collaboration with all the sectors and the industries so that life can go back to normal.
Yeah, so I'm understanding you well then, MEC, to say this is still a proposal. You're not necessarily telling the liquor outlets that this is the way to go, not that you've got the authority to say that, which is why I was asking about the legal implications. I think there's no question about the importance of vaccines and getting more people to come and vaccinate, also just the dangers that we pose towards each other if we are not vaccinated. I think people can make informed decisions. We know about the benefits of vaccination. You are protected against severe illness, possible hospitalization, death. There's research that indicates that even you contracting the virus and transmitting that risk is lower when you are vaccinated. So we need to continue pushing for people to have this kind of information so they can make an informed decision whether to vaccinate or not. But isn't it also important that perhaps you look at whether you can, in fact, deny someone a service on the basis that they are not vaccinated before you make that as a proposal, given that liquor outlets can just go with it without necessarily understanding the legal implications?
I think, as I've indicated, those are the areas that we are looking into that. But I'm not a legal expert, but a liquor outlet can deny you access to their store. It's up to them for whatever reasons that they would have, if it's for the interest of the public. Because when I visit many stores, they've got the right, they can reserve their right towards access to that. So if indeed we are in this together with the liquor industry, we can be able to come up with a way how they can deny you to buy alcohol if you are not vaccinated. It's the same situation that will come in future to say, if I'm owning a gym, for instance, do I have powers to can say, you can't access my gym if you refuse to be vaccinated? I think those are the things that we are exploring, and we're looking into that. And I'm glad South Africans today, it's no longer about Limpopo. They are engaging in this topic to say, is it possible? We have seen it happening in other countries. Yes, it's not a law to force people to be vaccinated in the country, but what we are saying is that let's look into the law. If it allows me as a retail owner to say, you can't access my store if you are not vaccinated, because you pose a danger to my other customers and also to yourself.
Yeah, and hopefully we're going to get some legal clarity on that. I mean, can you do that? Is the greater public health more important than individual rights? And hopefully the courts may even help us clarify this issue. I saw that you said as part of your campaign you'll be encouraging women to reject invitations to romantic dinners with men that are not vaccinated. So no vaccination card, no date is what you say.
We have started that campaign to the 18-year-old. It's not a law, but we're saying to them, if somebody asks you for a date, you must ask them, are you vaccinated? If they are not, you refuse. I mean, remember we had a campaign that no condom, no sex. And that was not a law. That was just a public health conscientizing to say the girl child. You must be aware that if somebody sleeps with you without a condom, it's not a crime. The person can do that if it's not paid. But however, you must know the danger of you getting to contract this disease. So we came to that campaign to say, no condom, no sex. Like now we're saying, no vaccine, no date, no vaccine, no alcohol. It's just a campaign that as public health expertise, We need to get into that and get our people to understand that we're doing all this in order for us to assist the nation towards getting to herd immunity. And what is important is what all of us want, to get back to normal. If you look at what the impact on mental health the particular pandemic done, it's very huge. For me, where I'm sitting here, the health sector itself, we have been taking away all resources, focusing on dealing with this pandemic, ignoring even other, neglecting some of the burden of disease. And I can tell you the danger here is that you see more and more people dying of other conditions because all of us now are focusing on this global pandemic. So we want to go back to normal so that we start dealing with TB, HIV, AIDS, diabetic, and all other ailments that are affecting our people.
All right, let me see. Thank you. I would say you must add there that the men as well must say to the women, because some women are the first initiators, right? So if the woman wants to take us on dates, we must also be able to say, no vaccine. And if you don't have a valid reason, because some people have medical reasons why they're not taking the vaccine. If you don't have that valid medical reason and you're relying on fake news, why must I go on a date with you?